My name is Maria Bojoli. For this week, the patient present with ankle pain. The differential diagnostic are inversion ankle sprain, fracture, and tendinopathy. We are going to start with an inspection. Now with inspection, we're going to observe and look for any scars, any discoloration, any abrasion of the ankle, and we're also going to observe for any asymmetry. Now with asymmetry, we are going to make sure that the patient has all of his toes and that all his toes are well proportioned to each other. And we're going to make sure we observe for any thickness of the skin, any swelling. Lastly, we are going to have the patient stand up so that I can observe for any color in the feet from non-weight bearing to a weight bearing position. So I'm going to have you stand up for me. Step forward just a little bit. Okay, next, gonna have you take a seat for me. So the next thing is the palpation of the bony palpation basically. And we are going to start with starting to palpating the calcaneus down here. You observe that. And then we're gonna palpate the subsentaculum tali, which is like right over here. There you go. Locate that and palpate it, and we can. There you go. I'm not sure if you want that bilaterally, but the subsentaculum tali is right over here. Okay. And then next, we are going to palpate the medial malleolus. And the lateral malleolus. Put your ankle. There you go. Thank you. All right. And then we are going to palpate the talus. So talus will be right over here. Navicular, right there. And the three cuneiforms. Now the three cuneiform, if I come over here, right here, right here, and then I think I forgot the cuboid, which is right over here. Okay, the 5 metatarsals, if you come over here, they're right over here. And we are going to also palpate the metatarsophalangeal joints. Now, the metatarsophalangeal joints, if you come right over here, there you go. All right. I'm going to start by palpating the soft tissue. And to begin with, we're going to start with the tibialis posterior tendon. And so we're going to begin here medially. So it starts right here. Okay. And next we're going to palpate the, we're going to palpate the sprain ligament, which is right here. I'm now going to palpate the tibialis anterior tendon. So I'm going to have you lift your feet slightly up for me. And then going to palpate the tendon, which is right here. Okay, and then I'm going to have you put your feet flat for me. I'm now going to palpate the deltoid ligament, which is relaxed. Thank you. And then the deltoid ligament. and which go to the various part of the feet. The fibula brevis, aka peroneus brevis ligament. Okay, I'm going to bring your feet up and out from me, and I'm going to basically palpate behind the malleolus right here, all the way here. And then I'm going to palpate the Achilles tendon, which is right here. I'm now going to palpate the plantar aponeurosis. I'm gonna have you bring your feet up for me, just like so. And then it's about right there. Okay, I'm gonna have you bring your feet this way from me. I'm now gonna palpate the anterior talofibular ligament. It's gonna come right here. So now I'm going to look for the posterior tibial artery. So we're gonna come back right here. I'm gonna hold that for about 3 to 5 seconds. Okay, and next we're gonna do the dorsal pedal artery. I'm gonna come right here near the cuneiform. Right here. I'm gonna hold that for about 3 to 5 seconds. Okay. Next is the range of motion. All right, patient, you ready? Can I have you point your foot up for me? Going the feet up, that is ankle dorsiflexion 20 degree. Can I have you point your feet down for me? That is ankle plantar flexion 50 degree. Next, can I have you point your feet in for me? Curl your feet in, just like so, perfect. That is gonna be subtalar inversion 5 degree. And can I have you curl your feet out for me, outward? Curl them now. Yeah, that's gonna be subtalar eversion 5 degree. All right, relax. I'm going to have you point your toe down for me. That will be first metatarsophalangeal joint flexion. Now I'm gonna have you point your toe up for me. That would be first metatarsophalangeal joint extension. We are now on the ortho part of the video. I'm going to start with the jaw test, and I'm going to perform that now. I have your feet just run the holder here, right here. Okay. Now, the positive will be translation with the talus moving away from or toward the tibia, which will indicate when the tibia is pushed, foot is pulled, there's a tear instability of the anterior talofibular ligament. And when the tibia is pulled and the feet are pushed, there's a tear instability of the posterior talofibular ligament. I'm going to perform the ankle dorsiflexion test. Okay, the positive would be that the feet cannot dorsiflex when the knee is extended, but is able to dorsiflex when the knee is flat, which will indicate contraction of the gastrocnemius muscle. The foot cannot dorsiflex on either knee position. That will indicate contraction of the soleus muscle. To perform the rigid or supple flat feet test, first I'm going to observe the patient with their feet flat while sitting down. I'm now going to have you stand up for me with your feet flat. Okay, you go ahead and take a seat for me. The positive will be absent of medial longitudinal arch in both positions, which will indicate rigid flat feet test. And there's another positive, which is the presence of medial longitudinal arch while seated, with a loss of medial longitude arch while standing, which will indicate supple flat. From the Holman test. First, I'm gonna have the patient, raise the patient leg while stabilizing at the calcaneus. And I'm going to dorsiflex the feet like so. Okay, now the positive will be deep pain in the calf, which will indicate deep vein thrombolysis. I'm now going to perform the Thompson test. I'm going to bend the patient's knees by the 90-degree angle, and I'm going to squeeze the belly of the calf. All right. The positive will be absent of the foot plantar flexion motion, which will indicate Achilles tendon rupture. I'm now going to perform Martin test. Okay. The positive will be sharp pain in the forefeet, which will indicate metatarsalgia or neuronal